Chain of Hope Jamaica was established in 2003 to develop a local, sustainable cardiac service to serve the children of Jamaica and the Caribbean born with heart disease or with acquired heart disease.
So as we close out Heart Month, here to tell us more about this program is consultant pediatric cardiologist at Bustamante Hospital, Dr. Sharonne Forrester, and professor and interventional cardiologist at Johns Hopkins Children's Center in Baltimore is Dr. John Thomson. A very warm welcome to both of you.
Good morning. Thank you for having us.
Thank you so much for being here with us. I would love to first start out with telling us more about the cardiac program at Bustamante Hospital.
Well, as you mentioned before, the cardiac program, what we do is that we diagnose and treat children who have heart disease. This heart disease may be congenital, meaning that you're born with it, or acquired. Now, if a child is going to be born with a heart defect, it's quite likely it's going to be a heart problem. And some of these children will require some form of intervention, be it surgery or what we call cardiac catheterization. So that is essentially what we do at Bustamante. And we're supported by various charities, one of them being Chain of Hope, who has been supporting the cardiac program at Bustamante for the past 20 years. Last year, they celebrated their 20th year of coming to Jamaica to assist us with the training of our local staff. That training may be here locally or overseas. Providing us with the disposables that we need to do either our cardiac surgery or our cardiac catheterization, which is one of the things that we're doing this week. We're doing a training mission led by Dr. Thomson, where we're doing cardiac catheterization on some of our children.
How do you find that these... Oh, sorry, go ahead.
I was going to clarify, but you began to speak about the Chain of Hope. Tell me more about Chain of Hope and their work, particularly with the Cardiac Center at Bustamante Hospital.
Well, Chain of Hope is a UK charity that was formed by Professor Yagdi Makoub, and they support cardiac work in Jamaica, not just Jamaica, in other countries. But in Jamaica, what they do is that they provide missions. So different mission teams come, be it to do surgical cases or catheter cases. So they send volunteers, doctors, nurses, intensivists, a lot of team members to come and assist us. And during these missions, they also train our local staff. So there's continued training of our local staff so that we can essentially build a sustainable system here to take care of our children in Jamaica.
Sounds good, and I want to hear more. But let's take a quick break, and we come back after news. TK is on standby with the news, and we'll be right back for more from this hearty discussion.
All right, welcome back, and still on the heart of the matter. You see what I did there?
Yeah, I like that. You know,
Dr. Sharonne Forrester.
Heartiest congratulations to you.
Consultant pediatric cardiologist at Bustamante Hospital, and Dr. John Thomson, professor and interventional cardiologist at Johns Hopkins Children's Center in Baltimore. It's a mouthful.
Before the break, I was curious. I asked him in the break, but I'm going to ask him now to tell us what are some of the frequent diagnoses among children that we find, and can a child live with these conditions?
Yeah, I think that 1 in 100 babies are born with a heart problem, and I think that's quite a surprising statistic when people hear that. Most of the time, those problems are relatively minor. They're holes in the heart, valve problems, but sometimes they can be really severe problems, such as missing a whole portion of the heart. So it's a very variable specialty. There are lots of different problems, but it is common. We see a lot of children with heart problems. It's busier than you think.
And if left untreated, because you know in Jamaica we always hear, you know, some have a hole in my heart, like it's commonplace. But if left untreated, is it something that you can go on to have a normal life with?
Well, it depends on what the defect is. some complex defect will affect the quality of the child's life. So they may not be able to play as well as their friends. They get tired very easily, and so they're symptomatic from early on. And if left untreated, it may decrease both their quality and the length of their life. So it's always important, if we can, to get in and correct the problem as soon as we can.
I'm curious to know what areas you need support in, like what do you need help in? If you were able to, like, you know, ask our government for help in a specific area, or even people of Jamaica, where would you need that support?
Well, cardiac work in children is very expensive, so funding is always needed. So that is why we at Bustamante are grateful for the support that we get from the Chain of Hope charity, and there are other charities that have assisted us. Gift of Life International, Rotary International through their New Kingston branch. There are other local charities such as Sagicor, but we never say no to more, and there's always need for more. We need to maintain the equipments that we use. We need to provide what we call the disposables, the consumables that we need to operate on these patients or do our cardiac catheterization. So funding is a big. What we also need is blood, especially for our surgical program. We can't do a heart surgery without having blood and blood products. So if we have donors who could go out and give blood for our children to undergo heart surgeries, that as well is very important.
You mentioned equipment. Do we have adequate, and I'm smiling as I ask the question, adequate equipment? Are there needs for equipment? And the second part of the question is, how has the international missions and visits impacted the training and skill set of the practitioners here?
Well, with regards to equipment, we always need more. What we have, we do need to maintain. And there are other equipment that we need in order to improve the service delivery to our patients. So equipment and servicing is a big, because you may have the equipment, if it's not working, it's not helping you. So maintenance of these equipments is a big factor in what we do. What was the second question?
The training and
it has been excellent in that, for example, when Dr. Thomson comes down, he comes down with a team of other volunteers that impart training onto our local team. Doctors, nurses, anesthetists, radiographers, everybody is taught in-house so that we can, you know, elevate our skills and be able to do the work on our own and create a sustainable program at Bustamante.
And I know your favorite place to visit is Jamaica,
Is
right?
Jamaica.
I've grown really fond of this island over the years, and I really mean that, and the people.
I
I love coming here, and what's really clear to me is there's fantastic talent here. Because if there isn't the talent, you can't train, but there is here. And so we can work with people, but also see a light at the end of the tunnel.
Love that. That
So
makes
for
me
the-
feel very hopeful.
Very, very hopeful. So for the foreseeable future, I mean, of course, the missions will be coming.
Of
and
course.
the training will be
Continuing.
continuing.
Yes.
Happy to hear that.
Thank you so much for joining us today.
Thank you for
Appreciate
having
it.
us.
Can I call you John?
Of course you can.
Can I call you Sharon?
We're going to talk about football in the break, right?
Thanks for joining us this morning, Dr. Sharonne Forrester and Dr. John Thomson, who joined us this morning for a hearty discussion
Yes, indeed.
about heart health.
He won't
All
drop
right?
it.
After we break, we open the door to inclusivity for those who are physically unable. Stick and stay. We'll be right back.